wonderful to have you here online. Absolutely delighted to be chairing, I think, what's going to be an absolutely fascinating conversation over the next hour. As Kristen said, I'm Richard Sullivan from King's College London, and I'm going to be your compere over the next hour or so. But the most important people, let me introduce to our extraordinary panel we've got here today. We're going to be talking about the social and political consequences of COVID-19, particularly in the MENA region. Firstly, from the Institute of Community and Public Health in Birzeit University, in the West Bank of occupied Palestinian territories, it's a huge, great welcome to Dr. Wiem Hamadou and to Rita Jackaman as well, Professor Rita Jackaman. Welcome, both of you. Thank you so much for joining us. And just to say, you'll be able to see Wiem, but not Rita because of the internet connection. So don't change your screen. That's absolutely as it should be. And our third panel member is Dr. Hannah Kinsler from the Department of Global Health and Social Medicine, here with us at King's College London, a long-standing collaborator with Rita and Wiem, has been there many, many times. So wonderful to have you, all three of you here. We're going to have slightly unusual. We're not going to have formal presentations. What we're going to have is actually a conversation where there'll be some questions posed and some reflections. And broadly speaking, what we're going to be doing is we're going to be looking at the sort of impact of COVID-19 broadly in the Palestinian territories at the moment, and then segueing from that to talk more about the political, economic consequences, including the impact of disabilities such as mental health issues, and then finally address solutions and actually asking the question, who needs to fix this and how from an international perspective. So I think that's enough from me. Please do start sending in your questions as soon as you want. We'll collate those as we go along, and as we find natural breaks, we'll present those back to the panelists. We will sort of draw the conversation with the panelists to a halt at around 30 minutes to have a more broad-ranging examination of some of the issues they brought up. So without much ado, I'm turn over to my esteemed panel, and the floor is all yours. Thank you.
Good. Thank you, Kristen. Thank you, Richard. So as you were saying, we will have a conversation as we have these conversations between us and as we're enjoying them. And I'm going to kickstart this off by actually asking Wiem to reflect on the current situation, because, I mean, unlike the UK, the Palestinian Authority reacted very swiftly to COVID-19 with a lockdown that saved a lot of lives. Now that the lockdown eased, you apparently are seeing a spike like you haven't before. And if you can just say something towards these new developments.
Sure. So yeah, first of all, thank you, Kristen, and thank you, Richard. Yeah, so like you said, Hannah, initially, right when the first cases were confirmed early in March, we had a very strict lockdown that lasted for over 2.5 months. And I mean, with varying degrees, and things stayed pretty much under control for the most part, because it was small enough where they were able to actually track the source of different outbreaks, and the numbers were kept to a minimum. And like you said, thankfully, we didn't have a huge amount of deaths or even serious complications that we heard about from other countries. But since the restrictions have been eased, since late May, let's say for about like 3 weeks or so, about 4 weeks now. The last couple of days, we've actually had a spike in cases that's had everybody very worried. So today, as of this morning, we had 82 new cases. Yesterday, there was over 100 new cases, and the day before that, also 80. And it's important to point out that during the whole first 3 months, there was never a single day where we had that many cases reported. So this is actually quite worrisome for a lot of people. Most of them right now are concentrated into governorates and with Hebron and Nablus, with more of them in Hebron. And now so both of those districts are completely under lockdown as of late, and they're trying to get to the source of the outbreaks. And I think, you know, it's so everybody's worried about the outbreak. They're worried about, so you see stricter measures. They're also enforcing a lot more of the, you know, wearing masks in public and other protective measures that people weren't necessarily adhering to as much as, you know, as much as we would have liked. But the issue now is also in thinking about how to actually deal with lockdown measures once again. One of the things that doesn't really get spoken about as much is the first 3 months or so of lockdown had a lot of financial and social implications on people. And this is why it's actually a much trickier territory now, where it's probably not going to be possible to actually impose a full lockdown, especially since the government is not in a position to provide alternatives to people. And maybe, I don't know, Rita, if you have something you'd like to add at this point before we go into the broader
thing. Just that until the latest surge of the past week, at least 2/3 of the cases came via Israel. And they came via Palestinian workers who work in Israel as cheap labor, elastic labor force, to be employed when needed and to be expelled when needed. And given that we are an occupied people, according to the Geneva Convention, it is the responsibility of Israel to be able to check these workers before coming home. So they've been doing that without checking. In fact, there were some cases where people who had fever, workers, were thrown on the pavement of roads just like that. And it turned out they didn't have COVID, they had the fever. But that's normal. I suppose normal is not the word. That's what colonizers do. And colonizers do that. During the period where we've had COVID, we've had more attacks by settlers and the Israeli army than before. Not only this, plans are underway to annex 60% of the West Bank, Area C. And so here we have suddenly an exacerbation of the political situation compounded by COVID, and of course the economic situation. So we really have a terrible situation right now, which we don't know how to get out of. There's something else I want to link to here, is that Palestinians have been colonized for a very long time. And I want to tell you, post-World War I, France and Britain decided to cut up our region with a pencil and a ruler, what was called Greater Syria, which ended up with a disaster in Syria, in Lebanon, in Iraq, and of course in Palestine. And the cheek to me, the cheeky thing is that even the United Nations in the late 40s agreed to give a big part of Palestine to Jewish people who suffered tremendously in Europe as a result of Hitler, etc. And they suffered terribly. It was the most tragic piece of history that we know. But nevertheless, a problem that was created in Europe was dumped on Palestine. They wanted to get rid of that problem, so they very simply, the colonialists, gave Jews half of Palestine, if not more. Now, I keep saying I just don't understand this logic. People keep telling me, but that is the logic of colonization, and that's exactly it. The logic of colonization continues today in Palestine.
Yeah, no, definitely. And I think maybe to pick up on that point, it's the logic of colonization, but it's also the logic of settler colonialism. So and I think it's important to actually recognize that within that history, especially the way that we talk about Palestine now, you know, usually people assume that we're only referring to the occupied Palestinian territory that was occupied in '67, so the West Bank and Gaza. including East Jerusalem. But like Rita said, lately we've seen spikes in settler attacks. There are still ongoing talks of colonization. So at the same time, there is this pandemic that the whole world is dealing with. Israel, as the colonizing power, is supposed to be responsible for the health of the population, or at least they're supposed to be facilitating the health of the population rather than putting it in more jeopardy. Which is, and at the same, but it's also important to remember that for people, this is part, and then oftentimes people would talk about two different epidemics. You have the epidemic of coronavirus, and then you have the epidemic of colonialism and occupation. And what that's done over time, because as a baseline, what we're starting with when the pandemic first began, we're actually starting knowing that we have a weak infrastructure, that we have a weak health infrastructure. There's a lot of precariousness due to the political, economic, and structural determinants. And like Hannah mentioned earlier, the Ministry of Health especially, I think they did the best that they could given the resources. But at the same time, we've been operating in emergency mode. And the problem with that is that we get caught up in emergencies, and this is not a one-time thing. But there hasn't really been enough long-term development. And so this is partly why this focus on humanitarianism and emergency in the long term can actually be detrimental to health infrastructure and health conditions. And I think, Hannah, you do a lot of this work on humanitarianism, so maybe you can jump in here and help us with your picture.
Yeah, I think it is just so interconnected, from the colonial to the settler colonialism to the way humanitarian spaces are created, and basically where in the health field, health, whether it's during a pandemic or not, is seen as a project rather than a systemic program development. And I think this is what we're seeing here quite clearly in a context where you need to have actually both, where you need to have national health system development and yet also need to provide emergency assistance due to Israeli military attacks, settler attacks, etc. But in a situation like this, healthcare is often provided as a project, very much driven by international donors and project managers, for who delivering healthcare as a project is quite convenient, because projects have narrow goals, run over 1 or 2 years, and you can be quite flexible. You change the timeline, you change the focus, depending on the political climate. And 2006 was, I think, a very clear example. For aid recipients, on the other hand, this is terrible, because you can never build something. Everything that you build comes crashing down again as the focus of donations shift, as the timelines shift. And also, I think another issue for the donors is why health as project is so convenient, is that you can intervene in such contexts without actually questioning the status quo, without questioning the Israeli occupation, without questioning the role of Europe and North America in all this. And it has, I think these structures have made it just really, really challenging to respond to a pandemic like COVID. And so maybe I can just throw the ball back to you, and talk a bit about the kind of uncertainties that were created to the pandemic within this really complex political situation. You're muted, Wiam.
Can you hear me now? Okay. Yes, so I think, like I mentioned, the baseline, we're already starting with a lot of uncertainties that have to do with the structural conditions that we've been living under. So, if we're talking about the health system, it's an under-resourced, fragmented health system. where shortages, in basic drug supplies have been constant, limited numbers of beds, high reliance on referrals to Israeli and to an extent Jordanian hospitals outside of the health system, especially for services that we're unable to provide because of the restrictions that Israel imposes. So there is that uncertainty around the ability of the health system to cope, but then there's also the broader uncertainties stemming also from the political situation, which affects economic and social life. And this was something that a lot of people talked about. So they were faced with like all this uncertainty around the pandemic, and it was very, nothing like this had happened really before in their lifetimes, at least, so they've heard about it happening a century ago or so, but it wasn't something that they actually experienced firsthand. And one of the things was like, so a lot of people actually, they use different ways to talk about it. They talked about like shakiness, confusion, going into the unknown. One person that we had interviewed like talked about it as if she was going into a forest and not really knowing whether monsters were going to come out, and so you have these very sort of vivid descriptions in terms of what people were going through. And then what was actually particularly unique about the situation was in this specific situation, people, in order to protect themselves, people were asked to stay away from their social networks, which for us was like a very foreign concept as well, because if you look at other moments of time where the political situation escalates, people really draw on social solidarities and collective solidarities to actually get through these situations. So this sort of, so the fact that they actually had to stay away from those networks, at least physically, was part of that uncertainty. And they were really worried, especially about older people and children. And they were really like, and the part about them potentially being vectors of this disease and harming those closest to them without realizing it. I think that was something that people really struggled with and emphasized. But then as we saw, like with the progression, and I think, the lockdown did happen early, that minimized the numbers in terms of the cases and also the complications. But at the same time, there was a lot of economic fallout that we don't have social protection mechanisms to actually step in on an institutional level and take care of. So people were becoming increasingly worried about hunger, not being able to work, not being able to actually provide for their families, even though a lot of them noted that there were, collective solidarities were activated and, donations were provided, but it wasn't seen as something that was sustainable. So this is sort of where it's at right now. And now you see more of that discussion where it's like, are we going to just focus on the health aspects and try to impose these restrictions on the same scale? But then at the same time, you have people crying out from the effects that they faced because of, just especially the economic fallout. And I think even with more vulnerable populations, this is especially important. Maybe Rita, you can say a little bit about the groups that are actually hardest hit by some of these measures.
Yes, but if you'll allow me to go back a little bit and say that in relation to what Hannah was talking about, humanitarianism and aid, we've always tried as Palestinians to combine immediate survival needs with longer-term development objectives. And we were pushed not to do that by international aid and their vagaries. They don't take that into consideration. They derail whatever we've built because they have the money and we have to follow because we don't have any money. So that's one point. The other point is that what Palestinians really, really need is justice and freedom, not more food aid. Yet the whole world seems to be donating, etc., mainly food and mainly in emergencies without taking into consideration whose responsibility is it to assist Palestinians in achieving justice and also freedom. What happened to Palestine was a result of Europe's decision and now America's decision. And I'd like to raise that as a question to the audience. Now, back to what you were talking about, several groups have been neglected here. And the main issue has been to lock down and not take into consideration the consequences of lockdown on the family and family relations. Now, women, for example, have been complaining about too much to do, too much cooking, too much cleaning, and on top of this, homeschooling. And it has become for some unbearable. Also, in a study that my students did, it turns out that people who are most distressed and most insecure, humanly insecure, are young ones between 18 and 22 years old at Birzeit University, not the older ones. And it makes sense. It makes sense that they are young, they want to graduate, they want to start a life, and they're stuck in the category of youth with no end in sight. In addition, for example, several other groups have been totally neglected. We don't hear much about them. For example, people with disabilities. What happened to them? What happened to their access, the need to access services? What happened to the prioritization at home between a disabled person, a person with disability, and other people? These are all questions that we need to study, but it doesn't seem that they achieve interest from the part of neither international aid, nor the Palestinian Authority, nor anybody else. And we remain with the question, what is happening to these categories of people who are neglected?
Yeah, and I think in addition to that, so what you said about young people is really important. And we also saw that with a few of the interviewees that we had interviewed, where they talked about, especially recent, like people who just graduated, and this was supposed to be an important transitional period. And so they had some plans, and now it's like this inability to plan and not really knowing what's going to happen, which, you know, is something I think we hear about globally, but it's also taking on very specific forms here. But yeah, there are these precarious, you know, vulnerable groups. So you mentioned like disabled people, women in some households, young people, and also, like I said, the day laborers and informal, like workers in the informal sector. This has been one of the groups that's been hardest hit, especially with sectors completely closed for months, with no alternatives. And this is where you also saw a lot more critique of the official response to the pandemic. And this is something that we're hearing about a lot more recently. And then the other thing is there are, you know, yesterday there was, they had, the Ministry of Health had posted that one of the hospitals that actually provides care for cancer patients, there was a staff member that was found to test positive. So they closed down the oncology ward. They tested all the patients. Thankfully, no one's tested positive, but now they're asking all of them to go into quarantine. And with, you know, people with cancer, with people with chronic diseases and other, you know, and immediate health needs, this was one of the big things that didn't get enough attention. What are they actually doing? Where are they going? In some cases, we heard about, for example, in different municipalities, what they tried to do was for people with like things like hypertension, diabetes, what the ministry allowed some of these municipalities to do is to then deliver medication to people that have chronic conditions, including, I think, some psychiatric conditions, but there weren't really any visits. A lot of non-emergency procedures needed to be postponed, and the numbers are in the thousands. And so this is something that the health system then needs to reschedule, and it's already being strained by the response to the pandemic. And this is why I think it's actually really important to shift the conversation around development and the infrastructure that's actually available, and what is causing the health infrastructure to be as weak as it is, and what is causing it to be as fragmented as it is. And the solution, I mean, and part of that is related to the political context and occupation. Part of that is related to donor policies and humanitarianism and this emphasis on emergency. And to an extent, there is also a Palestinian responsibility in terms of planning, and also the presence of corruption that's been noted in previous studies of the health system. But all of those together have, you know, created a situation where you have a very weak infrastructure, where different populations or different segments of the population are being affected by it. But we really do have to shift that conversation between, like Rita said, the balance between development and humanitarianism or emergency.
Shall I just wanted to say something about mental health here as well, because I think it's something that is often overlooked, just as the cases that you were mentioning before as well. And, you know, we recently heard about a rapid needs assessment report conducted by the Palestinian Counseling Center, which mainly focused on psychosocial issues very much related to everything that has been said, from increased settler and military violence, where the occupation actually used the COVID situation as an opportunity to crack down even more, which led, of course, to panic, anxiety, etc., or that is at least expected in the report. And one can imagine this. The lockdown also leads, of course, to increased overcrowding. And I think here it's important to also think about people in the refugee camps who anyway live in overcrowded situations, and which is not very conducive, I suppose, to family relations if it's just yeah, when you are under lockdown in this sense. But a group that I feel like we often forget in humanitarian settings, and we actually know pretty much nothing about, this is not particular to Palestine, are those with severe mental health problems, how they're affected by the disease. And at the best of times, our research has shown in Palestine that they receive no psychosocial support, that their mental health care is pretty much medication-based, which is often not available. I'm very worried right now whether the medication is available, whether it has to be paid out of pocket, how people are getting it, especially as they're afraid to maybe leave the house, and where people experience exclusion and stigma during COVID and on other times as well. And sort of going back to what Rita was saying about the gendered impact of COVID, I believe that carers for people with severe mental health problems receive no support in best of times, except from their family networks. And I suppose now they have a heavy burden to carry in terms of caring for their family members when there is just very little support. And I'm wondering about their own mental health during this situation. So I think as we have sketched out some of these issues, it is really important to come back to the question. So whose problem is it? Whose problem is this? Who has to fix it? I'm going to bounce that back and then come in if there's time. Shall we take, I don't know, another 3 minutes, Richard? Is that okay?
Yeah, keep on going. I mean, 5 minutes, and then I've got some questions to pose to you, which will fit in, I think, on the discussion you've had. But yeah, I totally agree. I mean, in a sense, whose problem is this to fix, and how do we go about it?
Yes, I mean, whose problem is the lack of freedom and injustice for Palestine? Whose problem? Of course, like Wiam said, part of our problem is the Palestinian Authority and also Hamas in Gaza. That's true. They're both fighting for power and not really looking at the interests of people, even though with the COVID, they've tried hard, but there were also problems. So we have that. But what about Israel? Why is it that the world is not really taking a good look at what Israel is doing? Why is it that this guilt feeling about what happened in Europe continues to linger, so that everything that Israel does is okay, and we are also always the guilty party? What about the global community, whether in health or other? What about the United Nations? What are they doing when it comes to Palestinian justice, and also now compounded by COVID? These are questions we need to ask, because as far as we're concerned, we were the victims of World War II, as simple as that. And we did nothing to hurt the Jewish people at all. It was not us. Yet a new tragedy was created in order to solve a previous tragedy, and it's been going on It's been going on for over 70 years. In fact, almost 100 years.
And I think, Rita, what has been happening, and you have pointed to this at the beginning also of our conversation, that the focus now is very much on disadvantage, on distributing food packages, on making donations for projects rather than system development. And I suppose by focusing on this disadvantage when responding to, let's say, an emergency like COVID-19, what we fail to do, I feel, is questioning and dismantling unjust advantage in order to address and change the role of disadvantaged communities. So we focus very much on the disadvantaged rather than on the advantaged, which is Israel, which is Europe, which is North America, and thinking about how these powerhouses need to make space, need to question their own privilege, their advantage, give up some of that in order for space to emerge that Palestine can actually develop in the way they want to develop.
Yeah. And I think that's important, Hannah. And so, like Rita said, there is, this, what we hear about now, because I think oftentimes, it strikes me when people talk about the conflict as if it's this, this conflict that's been going on for millennia. It hasn't. It's not a religious conflict. We're dealing with a settler colonial context, and with that, there are ramifications. A settler colonial context, that's where Europe and the United States have been very much involved in maintaining those structures, and I think we need to recognize that. And what humanitarianism does, it puts a band-aid. It doesn't actually address the root causes. And we see it over and over again. So we see it, we're going to the international court, and now in the international court, it's like, oh, do we have jurisdiction or do we not have jurisdiction? Can we actually, and then even if there are decisions like there have been before, for example, if we think about the separation wall, in 2004, that was deemed illegal by international law. It continued to be built, it still exists. And now it's like the EU comes in, they fund projects for seam zone communities, and to try to minimize some of that impact. Bulldozers come in, they might, like we've seen also in the Jordan Valley, they might tear down the schools. The EU then renegotiates building them back up. So you see all these resources that are being put in to actually just put band-aids on it without ever really addressing the root causes. And the root cause is this settler colonial project that continues to extract resources, like now with annexation, and it's continually extracting resources. I mean, our groundwater we purchase back from Israel, just to give you a very small example. And the long-term effects of this on a population are really important for our health. They're really important and I think more importantly for issues around justice. And we can't just continue to put on band-aids. We need to actually address the root causes, and here the root causes are political, and the whole international community is actually implicit in this.
I would have thought that with what's happening in the United States, maybe, just maybe, people will make the link of disadvantage and injustice with the COVID situation. But it doesn't seem that people are talking about Palestine. That's what I find ironic. They talk about disadvantage, they talk about disproportionate effects of COVID on people. They call them the poor, I will call them the working class. I mean, and so on and so forth. And in the process, we continue to be stigmatized as Palestinians. We're either terrorists or victims. And in order to access the food, we have to play victim. So we have to remove our agency in order to get the food aid. And all of this raises questions about what humanitarian aid is really trying to do. I'm not suggesting that food aid is not important. I'm suggesting that it cannot be divorced from other issues, fundamentally the political, which is creating the condition for the need for food.
Maybe that's wonderful. Look, maybe at this point we'll take a pause in the conversation just to reflect back some questions that we're getting, and in particular to tie this in. So from Penelope Quinton, who's put in a comment about the issues around the Palestinian reporting about what's actually going on in terms of restriction of access and movement. And it speaks to, I guess, the narrative at the moment, with the narrative both within the pandemic and also obviously within the resurgence of the Black Lives Matters movement in the USA and increasingly in Europe. It feels like this voice that Rita was just talking about simply isn't getting out there, that there isn't a recognition of what's going on in terms of the impact of the pandemic, the use of the pandemic as a smoke screen for annexation, for increasing restriction and access, which one feels could easily go beyond the lifespan of the pandemic. So you could be in this sort of perpetual twilight zone where there's always an infectious risk, and therefore these restrictions are justified forever. Do you want to maybe say something a little bit about that and where the Palestinian voice is coming from and why it seems to be so silent on the global stage?
Well, I mean, the Palestinian voice keeps trying to rise, and the silence is about the fear of saying anything negative about Israel. And the problem is that somehow the lobby, the Zionist lobby, has managed to conflate in the minds of people that if you are anti-Israeli actions, you must be anti-Jewish, okay? So by definition. And that is absolutely wrong, because some of our best friends are Jews, and some of our worst enemies are also Jews who are Zionists, staunch Zionists, a lot of them in the United States, but everywhere in the world. So that's why there is a lobby which kills voice. And as much as we have tried, and we will continue to try, this lobby is ferocious, very strong, lots of money, very America-oriented and Canada, and they know how to deal with lobby stuff, while Palestinians don't have that kind of access to the United States, especially, which seems to dictate. That is a main part of the problem. The issue now is how to unlink the notion of Zionism from the notion of being anti-Jewish. If we succeed in doing that, as we're trying very hard, and increasingly, for example, in United States campuses, young people are beginning to recognize that being anti-Israeli actions in Palestine is not being anti-Jewish. Maybe we can have a voice heard, maybe.
Can I just sort of jump in as well, because I feel that the repercussions and the consequences of this are, again, have been shown during this time of COVID, where the Palestinian Authority has acted exemplary in response, and where you can see that an exemplary response is not honored, it's not taken as an example, there's no humility worldwide to actually look at an example that where a government has reacted appropriately to safeguard its population. And yet, this information is not coming out. Again, one focuses on the terrorism angle that Rita is talking about, instead of looking at a really successful intervention, which is now hampered because of de-development that Wiam was talking about, the settler colonialism that leads to de-development, where all of a sudden the resources are not there, the structures are not there, where probably another lockdown cannot be afforded. And I think this is just, yeah, it's tragic to see this, where with an immense reaction, the world is again not looking, not hearing, and reacting just in the humanitarian space because it's so convenient and because it does not have to address the political questions that Rita was referring to, that are required, that we have to address if justice is ever to prevail.
Just one point, which is that neglect and injustice are most astounding forms of violence. They are violence the way we live them every day. Thank you.
So I suspect I'm moving on to other questions, sort of, and so I wrap them up here, which is taking the sort of broader view of the impact of the COVID-19 pandemic within the health systems, and you all talked very eloquently to this problem of humanitarianism just living hand to mouth here, and there's no deep roots of health system going into the Palestinian soils because it's always been based on these superficial short-term goals and projects. I guess maybe just looking forward here and looking at the way that the Palestinian Authority, maybe you could speak to Gaza as well. How can the pandemic be used as an opportunity for bringing development back to the front? In other words, you know, we've heard a lot from WHO about universal health coverage and how the pandemic has exposed the importance of universal health coverage, how has it exposed the importance of health system strengthening. But practically, I guess, they're very fine words, but what practically does this mean for the Palestinian people going forward?
The question is, who is responsible for occupied people's health? And according to all the conventions, UN related to this, it is Israel. Yet Israel systematically chokes us, and as a result, we are being developed, and as a result, our health system, if you can call it system, I call it fragments, is starved for funds, disjointed, unable to cope under ordinary conditions. So you can imagine what is happening under COVID-19 conditions. And that's the fundamental issue which needs to be raised. Who is responsible? Is it the Palestinian Authority with its limited, it has limited sovereignty over the land. It cannot go, it's not allowed to go into 6% of the land, Area C, where people need help. These are enclaves of people who have been literally separated from their government by another government. And it's controlling everything, land, water, settlers, illegal settlers there, etc. Who is responsible for doing this and who is responsible for health? Ultimately, to me, I think we have to put things clear. It is Israel's responsibility for people's health in a context of occupation. Having said this, the PA and Hamas are trying, but they can't do much. Universal health coverage in Palestine does not necessarily mean much because we can't afford to provide services to all, and we can't afford to do preventive work well for all also.
Any comments on that you'd like to make?
Yeah, I think this is an important question, and I think part of what Rita said is important to remember, that even if we're looking at it from an international law standpoint, Israel does bear the ultimate responsibility. That doesn't mean that the Palestinian Authority and that Hamas don't have a responsibility towards the populations that they serve. And I think with COVID, these things are coming out. So there are different layers. So so if we're thinking about Israel's responsibility, at the very minimum, like if we're thinking from a legal standpoint, at the very minimum, they're not supposed to obstruct efforts at providing services to the population or meeting the population's health needs. What we saw under COVID is the opposite of that. So even in areas where the Palestinian Authority was actually trying to minimize movement, to try to prevent some of the workers from going in and out across the Green Line, we had lots of people talking about how some of these, there were spaces, porous sort of entry points within the fences and within the wall that were actually kept open, because we need to remember that Israel's economy also depends to a great extent on Palestinian laborers that constitute this elastic workforce without any rights. And we saw that with how the workers were being dumped at checkpoints. So even the bare minimum in terms of just don't obstruct efforts, that wasn't met. So that's something that needs to constantly be recognized, and I think we need to approach it differently than the way that it's been approached. But then to your question in terms of then how do we actually even think about the health system, and I agree with Rita, it's it's not a cohesive system. It is a system of fragments, but I think we need to also try to start approaching it differently. And given that it is a system that's very aid dependent, the way that aid functions is not actually functioning in a way that then helps the health system develop to try to overcome some of these things. So this needs to actually be put into that approach, and we need to think more in terms of a developmental focus to try to, and and the other thing that happens is, for a while, donors were focusing on NGOs, and then they decided that since now we're in this state building effort, we're going to shift the focus now to the Palestinian Authority. And what this does is, rather than like actually working at bringing all the different providers together, you're creating competition between them over funds, and then that reproduces duplication on these other things. So there are things that need to be done within that system, and then also things to address the broader structural issues. And then within that, and there are so many sort of strategies and policy documents with recommendations about what we should be doing better. And sometimes it's almost like, it's very frustrating because you see these tensions come together. It's like, on the one hand, you need to be doing a better job of overcoming this fragmentation and working together and providing services. But at the same time, you need to also, these services, they're costing too much money. So you need to provide fewer social protections. And what we saw with COVID was like, around the world, what's actually really important is you need to provide more social protections in order to make sure that people are living healthy. So there needs to be a shift in sort of the way that the international aid deals with these issues, not just in Palestine, but in other contexts as well. And I think this is this is just one case that's part of a broader global phenomenon that we have to think about. And then there is this other layer of occupation and the political determinants of health that we can't forget. And that can't happen without any real accountability and calls for social justice.
I wonder if I could take that point then you made and maybe deep dive into something that you've all very eloquently worked on again over many years, which is around severe mental health issues here, and maybe to focus on that as a particular domain. Because I guess that my question, and maybe to Hannah first of all, is how has the pandemic really exposed even more and stressed even more the nascent services and approaches to severe mental health within Palestine? And do you think it's set things back? Because there's always this tendency that the focus has been so heavily on COVID-19. In a sense, other forms of health services, be they cancer, mental health, have just been left on the side. And I think it was Wiam, you were saying that the backlog of just routine surgeries, for example, is going to be horrendous. It's difficult enough in high-income countries to catch up with these, but even more challenging the situations you're in. And in some cases, my feeling is probably you'll never catch up, in the sense individuals will have there'll be premature mortality and morbidity because of this. But I think the focus maybe on severe mental health and how you feel that's going to go forward. Hannah.
Yeah, thank you. I think it's really hard to tell. I think we know very little about this for precisely the reasons that you were mentioning, that the focus is on COVID and other issues. And with regards to severe mental health, the focus has often been on other issues. So it's a really neglected area. So hard to tell. I don't think any of us have real information of how medication is dispensed at the moment, how people are assessed or reassessed. What I can say is that, or where I have at least some information about, is that people there are very few support groups in Palestine. There are one or two for people with severe mental health problems where they can come together, where their carers can get some respite, people can come together in a safe space, be together, and enjoy working or just hanging out together. And of course, these spaces have all been closed. I assume that it is very difficult to has been very difficult to stay in touch on a regular basis with these people who benefited from these very few services that existed in the first place. I'm afraid that people will have had relapses. People I know who suffer from obsessive compulsive disorder, especially when it comes to hygiene, I assume that they are struggling at the moment, where there is such an enormous emphasis on hand washing and hygiene, and I'm wondering how they are treated and cared for. So I think we know very little, and just again also here the situation of the mental health system mirrors the situation of the health system, where I have pre-COVID talked to people about the funding situation that always comes with strings attached, is short term, where basically policymakers, health providers have to at some point make their own decisions. You know, money comes in for one thing and they say, well, we have to say yes, but we have to do something else in order to actually continue our work, because we cannot switch constantly from one beneficiary group to the next, from one emphasis to the next emphasis. We do have to build a system, or a system that works for the place locally, for the people locally, that is responsive to not only the needs of people suffering from mental health problems, but also those caring for them. So I believe that yes, the situation, one can be sure, has become worse, but it has been pretty bad before. Plus, we lack information to say anything really specific. And something just to highlight is that I assume that families have been picking up the slack and have done enormous work during this time, especially women, but also other family members, to actually do the work that, let's say, in other places may be done by, maybe provided by institutions. So I think that we cannot forget that. So when there is no neglect, it is because people have been working really, really hard behind the scenes at home, despite the fact that, I suppose resources are scarce, services are scarce, etc.
But you know, I heard somebody saying it's a mistake in the West to have developed the nuclear family. So let me just point out to something positive. Here, the extended family is still part of life. And even if they don't live in the same apartment, they build 1, 2, 3, 4-story homes, and they are near each other so they can support each other. And in that sense, we have a big advantage. We hardly have very few old people's homes, and we have had only 5 cases of death so far. And I think this may have been due to family support, which is taken mostly by women, of course, but still this has come to be a real advantage in the Palestinian setting.
I'm really glad we've reached the hour now, and that's a wonderful positive note to end on, because I think 2 things. One is, the importance. This is obviously a program we've got for building capacity and capability in research. So it's about research illuminating how the successes of the Palestinian Authority have been in terms of COVID-19, but as Rita said as well, how social constructs have also protected the most vulnerable members of society. And as Hannah mentioned right at the beginning, we've done appallingly for that in the West in terms of vulnerability. Our elderly are shifted off into care homes where they are, exposed to the ravages of disease altogether, in social isolation, but incredibly vulnerable situations. And this is an incredibly important learning point. I should add that for those of you interested as well, we've been talking about severe mental health as part of this webinar. I think it's on Thursday at 9:30. Delighted to say Rita again will be joining us for another Research for Health in Conflict webinar, this time about therapeutic geographies, cancer control and palliative care. So not only will we obviously we deep dive severe mental health today, but on Thursday at 9:30 we'll be having another webinar talking about another non-communicable disease, which is extraordinarily germane to the West Bank and Gaza, which is cancer. At this point, we've reached the hour. I just want to simply say thank you very, very much indeed. We could have kept going and going and going. And I know everybody's stayed on right to the end, so it's wonderful. And thank you very, very much indeed to all our participants today on the panel, to William, to Rita, to Hannah. Really enjoyed this. This will be videoed and it will go out, I think, Kristen, on the website. So please do distribute to your friends and colleagues. You'll be able to watch this again and listen to this again. I often listen to these again and again just to soaks into my rather small brain. But as I said, on Thursday, we've got another webinar, and this has been brought to you by, of course, our program Research for Health in Conflict, which is funded by the UKRI Global Challenge Research Fund. So once again, thank you so much to our esteemed panel. Really grateful today for your insights, both the positive and the negative aspects. Thank you all very much indeed, and thank you, Kristen, for organising this.
Thank you very much.
Thank you. Thank you.
Take care.
Have a great day. All right. Okay.
Bye.
Bye.
Bye.